pelvic floor release exercises. These are also known as reverse kegels. So I thought I would just talk you through this handout that I often use with clients and the different sheets, different pages that I tend to go through when I am talking about pelvic floor release and reverse kegels. So I just also like to say thank you to Maeve Whelan, who is a physiotherapist based in Ireland with an organisation called Pelvic Physiotherapy. And she ran an advanced pelvic floor course a few years ago now in Glasgow, which I attended, which was a really good course with regards to advanced pelvic floor. So the pelvic floor release exercises are really the opposite to what often people think as how to strengthen your pelvic floor. And these exercises would often be a starting point for people who have a hypertonic pelvic floor or an overactive pelvic floor, and maybe have symptoms, for example, like pain with intercourse or pain with inserting tampons, or maybe kind of more than normal pain when going for a pelvic test, like a smear test. So this first sheet is the diagram of the diaphragm and the pelvic floor. So the diaphragm, when it's up, means the pelvic floor is held. So you'll see on the right here a wee example of what this looks like in terms of the positioning. So basically the diagram shows if there is a taut elastic band from the pelvic floor up to the diaphragm, this indicates the link and how tension is created. So if the diaphragm is held or if breathing is restricted, the pelvic floor will be held upwards too. So often with people who have a hypertonic or overactive pelvic floor, it might be that they've had years of pelvic pain and they've maybe got into a pattern of breath holding, or with being stressed, they kind of hold everything up, and that can be what causes the issues. And sometimes people will have had it for maybe weeks or months, or they could have had the issues for years, and that often means the longer they've had it, it generally takes a bit longer for them to rehabilitate. So the abdomen will also be generally held inwards, and this feeds into the same pattern of tension. So as kind of a modern pelvic health physio, myself and other physiotherapists would assess the whole core, not just the pelvic floor as well. So we'd look at the diaphragm, the abdominal wall, the back muscles, and the pelvic floor. So this is what we refer to as the whole core, not just the pelvic floor. So like I say, we're looking at the whole picture. So when it comes to doing the pelvic floor release, we want to make some changes. We're practicing the release basically to start with, and then that's the basis for building on. So we want people to be able to release their pelvic floor and lengthen the muscles first, and basically kind of normalise the tone before we would start to strengthen it in a more kind of traditional way. So the diaphragm can help initiate the release by breathing inwards using a sniff, as so, and the diaphragm descends. So we're basically kind of, if you imagine the movement, the diaphragm descends with the in-breath, and that helps release the pelvic floor as well. So if you have any experience of Pilates, often with Pilates, there's the teaching of the out breath and engaging the pelvic floor. So this is basically the opposite to that. And I often teach people that if they are, hypertonic pelvic floor and doing something like Pilates, to use the in-breath in between to relax the pelvic floor as well, because it's just as important to relax the pelvic floor as it is to contract it. So at the same time, we're going to be looking for a flop of the tummy, and that'll help with the drop of the pelvic floor. So in this diagram, the elastic band can be seen to slacken to allow this release, and this softens the fascia and the abdomen to the pelvic floor. So the next page is just a bit more detail with regards to the sniff. For purposes of releasing the pelvic floor, we want to make the diaphragm descend. So remember, like a piston, that movement expanding the ribs out to the side, and we don't want the chest to lift. So a lot of people tend to be kind of upper chest breathers or shoulder breathers, especially if life's a bit stressful. We want them to kind of focus their breath a bit further down compared to where they might be breathing. So as the individual breathes, or as you breathe, you want to keep the chest down and the diaphragm descends, making the stomach expand as a tummy breath. So a key part of this is that it mustn't be forced, and the stomach should stay completely soft, or this won't allow the diaphragm to descend. So the breath should be in through the nose, and it should be an audible sniff, so that you should be able to hear when you're doing it, to indicate that there's sufficient volume of air to make that movement of the diaphragm descending. And the breath in should be sustained for 3 seconds, and that allows time for maximal release. So counting to 3, and then the out breath comes after that. So the breath outwards, by contrast, is quiet and passive. A nice gentle out breath through the mouth. Okay, so just having a wee look at the diagram. So this helps to lift the diaphragm with the out breath. So the abdomen, when doing these exercises, I will advise women, and if you're going to be doing these exercises, try it in different positions. So you can try it in lying and sitting, and some people actually find it a bit easier in standing, just with the kind of force and the movement. So try it in different positions and see what works best for you. So when we're doing this as well, we're talking about the flop of the abdomen, which is an abdominal release. So this says about lying on your backs, but like I say, you can try in different positions, popping your hand on your tummy. And as you take that sniff in, feeling for the flop, so the tummy should come out a wee bit. And often this is counterintuitive, because often people kind of feel that they're used to doing the opposite. And there's kind of like chronic grippers. So there's people who are, you know, they've maybe been told from a young age to kind of sit up tall, pull their tummy muscles in. So it can take a bit of time to get the hang of, you know, something different and almost like the opposite to what people may have been doing. So just a wee note, if forced or performed incorrectly, the flop could result in stomach tension instead of a soft release. So if you're trying too hard, this can tense things up instead. So just be careful when doing the release, that there's a softening, not a tensioning. So with the drop, this is kind of what we're aiming to get. And again, to start with, you might find if you're doing this yourself, or you're helping someone else to learn how to do the reverse Kegel and pelvic floor release, that you don't feel a huge amount of movement. And I often say to women as well, again, that you're kind of like sending the signals to the brain, and that your body will do the rest. And then hopefully as time goes on, you'll feel a bit of a movement. There isn't a huge amount of movement. I'm just going to quickly show you at the pelvic floor area. There's really not a huge amount of movement, but as you become more in tune with the pelvis and the pelvic floor, hopefully you should be able to differentiate between a release and a lengthening of the muscles, and a squeeze, and as your pelvic floor muscles get stronger, a squeeze and a lift when the deeper muscles are working. So with the drop, the pelvic floor should be held just a little up from its fully extended state in order to support the organs and pelvis, and this is normal. However, it should be possible to let these muscles go to fully release, or basically kind of an extended state. There is a difference between a release and a lengthening, and if you're struggling to have a number two, a kind of bearing down. So we want to avoid that and just basically kind of release the muscles. So again, you'll see from this diagram, the direction of pelvic floor contraction. Basically, the muscles are moving this way as the pelvic floor contracts, and basically opposite as we look at this one with the release. So using that in breath, you'll feel the in, the sniff, the flop of the abdominal wall, and the drop of the pelvic floor muscles. So like I say, it can be difficult to feel at first, or impossible, especially if the muscles have increased tone and the pelvic floor can be held very taut. But the perception of that movement and the range should improve the more somebody practices the sniff, flop and drop, as it's termed here. There's more information on the pelvic physiotherapy website, and I will be doing other videos as well. So the last part of the sheet is looking at how often to do it. So I often say, with this type of exercise and other types of exercise, little and often is the best. So really kind of 5 to 10 minutes, or kind of 3 times a day, especially if somebody's experiencing pelvic pain in the kind of pelvic area, pelvic floor area. So looking to do all 3 steps, sniff, flop and drop at the same time. And the last page just covers basically what that's doing. So this is just a reminder, the less effort, the better. So it's not forcing it, but just letting your body kind of like tune into what, you know, it'll kind of get there and be able to do. So I hope you find this interesting. Like I say, we would often focus on these type of exercises when it comes to hypertonic pelvic floor. And I often say to people, like I say, it's just as important to be able to relax the pelvic floor. A lot of women, especially in pregnancy, are told to do their Kegels, and they might download the NHS app but it might be actually that it's not appropriate for them. So it's always important to be able to get a pelvic floor physio and an assessment to see whether traditional kind of kegels or pelvic floor exercises are appropriate, or whether actually you need a more individualised programme where reverse kegels might be more appropriate to start with. So if you've got any comments or questions, just pop them in the comments below. And if you are enjoying the content, please do like and subscribe to my page. Thank you very much.